My name is Moses Kalukande. I'm a professor of surgery, and in this respect, I'm the president of the Association of Surgeons of Uganda. So I take the opportunity and the pleasure to announce the launch of West Nile Subregion Surgical Camp, which is going to take place in September 2025.
In Uganda, at the heart of West Nile, where beauty meets resilience, a silent cry echoes through the communities. It is a cry for access to healthcare, safe and affordable surgery, to hope, healing and restoration. Prior to every surgical camp, the Association of Surgeons of Uganda, composed of a team of surgeons, anesthesia providers, nurses, radiologists, and laboratory specialists, visits the region assessing all health facilities through a pre-camp visit, and the work starts here. For each facility, we assessed its capacity to conduct a surgical camp.
What are the challenges? The challenges we have are staffing one of them, and we have even few beds. It is fortunate that you came and you found today doctors discharge many patients, get many patients just lying on the bed, on the floor, not on the bed, on their mat, because the bed alone is not enough. The mattresses are not enough for patients. The number of patients more than the number of beds and even mattresses.
We obtained community entry through the DHOs and CAOs, and together with the resident team. We looked at the available resources, the human resource, the patient screening areas, operating theatre, recovery rooms, wards, laboratories, radiology services, ambulances, food, and accommodation facilities available. We identified gaps, consulted with community leaders, and discussed areas of improvement to have the sites ready for the massive surgical camp in September. We asked the hard questions. During this assessment, we identified the facilities that will conduct specialized and complex surgeries. We have intensive care units, centers for breast and cervical cancer screening, and plan how linkage to care and the 30-day post-operative follow-up of patients will be achieved. We also requested resident teams to propose the schools where children will be screened for eye, ENT, dental, and musculoskeletal deformities. The needs are real. From the vulnerable walking miles to access surgical services, long queues of waiting for the surgery and inability to afford quality surgery, children battling with long-standing hernias, contractures from burns, musculoskeletal deformities, eye, ear, and dental problems. The adults suffering silently and losing employment from chronic conditions like hernias, goitres, cataracts. They all wait, they hope, they endure. Behind every surgical camp is an army with hearts and hands of specialists that donate their personal time and resources to conduct free surgeries, aiming at a total of over 8,000 surgical consultations and 2,500 surgeries for 1 week. General and specialized surgeons, theater and ward nurses, anesthesiologists and anesthetic officers, pathologists, laboratory technicians, radiologists, administrators, quality assurance, data clerks, resident medical officers, and medical students, each playing a part in this life-saving mission spearheaded by the Association of Surgeons in Uganda. For the people of West Nile, surgical camp will be more than a tent and a table. It is a chance to live again, to see again, to walk again. It is a chance for a mother to hold her healed child, for a father to return to the field, for a child to run without pain. This is what hope looks like.
anticipate we're going to reach out to over 10,000 people with surgical consults, and we plan to do at least 2,500 operations. That is on the curative aspect, but we also have the preventative one. We anticipate to look out and visit 10 schools, primary and secondary schools, where we'll interact with over 6,000 students.
We have just had a pre-camp assessment in the region. We've gone through 13 districts of the region. There is a lot that needs to be done, especially in some of the hospitals we visited, in terms of provision of equipment. A lot of people are waiting to have surgery.
We're excited. We're looking forward to get to this region and to serve the vulnerable population like we did in many years in the past. We are willing to do again.
But we cannot do it alone. We call upon your support with human resource, medical equipment and supplies, financial support for meals, accommodation, and transportation for the teams. We need publicity for mobilization of the patients. Together, with your support, let's make a difference. Let's bring light to West Nile. To send your contribution, here are our mobile money details and bank account details. For more information, please contact us on the numbers below or use our email